Good afternoon. Thank you for joining us today. I'm joined by Pat Allen, Director of the Oregon Health Authority, and Dr. Dean Sidelinger, our state epidemiologist. Today, I will lay out a framework that we will use as we approach Phase 2 of my Safer and Stronger Oregon plan. Then Pat will provide an update on the contact tracing teams that are being deployed around the state, as well as the latest updates on the state's testing capacity. Dr. Sidelinger will give an overview of the specific requirements for entering Phase 2. It's been 10 weeks since I announced Oregon's Stay Home, Save Lives order. Many of us expected and hoped that this would be a shorter detour from our everyday lives, that life would quickly return to normal. But as the weeks have come and gone, we find ourselves adapting to a new normal. People all over the globe now understand that we will continue living with the threat of the virus until there has been a widely available treatment or a vaccine. And unfortunately, that's going to take months and months, not weeks and days. When you compare Oregon to many other states, it's clear that we've been very successful at flattening the curve of the transmission of the virus. That's because Oregonians look out for one another. As my colleague Governor Como said, Oregonians are both kind and smart. Today, most of us live in communities where people are venturing out a bit. We do so cautiously, looking out for our friends, our family, and our neighbors. We are wearing face coverings in many work settings and when out in public. We are keeping our social circles small and staying local. We are covering our coughs, washing hands for 20 seconds with soap and water, of course, and we're staying home when we are sick. I want to say thank you to each and every Oregonian who's made tremendous sacrifices to protect the health and safety of our communities. Your leadership, both kind and smart, is why we've been able to begin the reopening process. I've mentioned before that I grew up in Minnesota, where every winter, as kids, we'd strap on our skates and venture out onto a local pond. We learned at an early age to step very carefully and cautiously. And that's what we're doing across Oregon now, moving together, testing the ice each time as we take a step forward, one step at a time. It's this careful and cautious approach that shows the true character of our state, our care and consideration for our friends, our family, and our neighbors. This cautious approach is keeping many vulnerable Oregonians safe during the pandemic. I know it's very frustrating that reopening has to move slowly. I know our economy has taken an extraordinary blow. But let me be clear, this cautious approach is saving lives all across the entire state of Oregon. Today, 35 counties, home to roughly 80% of the state population, are in Phase 1 of our Safe and Strong Oregon reopening plan. Dr. Sidelinger will provide some more background about how local and state public health professionals are collaborating to address testing, contact tracing, and isolation as needed. One piece I do want to highlight is the work we are doing to invest in culturally specific testing and contact tracing capacity around the state. The pandemic has shown how far short we are from eliminating health inequity in the great state of Oregon. The impacts of the coronavirus have fallen especially hard on our communities of color. OHA is training providers to collect race and ethnicity data and following up when this data is missing. We have been setting up community-based testing sites in Portland, Salem, and Woodburn, and contracting directly with trusted community-based organizations, particularly within the communities of color, to provide contact tracing, wraparound supports, and education. These are really important steps forward, and there are more to come. Now, let's talk about phase 2. We will continue to take a regional approach. Counties can be approved to enter phase 2 if they have been in phase 1 for at least 21 days and are succeeding in controlling the spread of the virus. Dr. Sidelinger will outline the specific criteria we will be using to evaluate when each county may enter phase 2. There are 31 counties that can now apply to enter phase 2 beginning this Friday. Counties that are approved to move into phase 2 will be able to relax some of the restrictions that have been in place in phase 1, and some sectors will be able to reopen. In phase 2 communities, we will be extending the open hours for bars and restaurants to midnight and implementing other specific guidelines. We are shifting from requiring to strongly recommending remote work for offices, allowing venues like bowling alleys and arcades to reopen and some recreational sports to resume, all subject to public health guidance, of course. Allowing pools to reopen under physical distancing and, of course, sanitation guidelines. And allowing venues such as movie theaters to operate again. And our social, civic, and faith-based gatherings can meet in larger, physically distanced groups. In addition, regardless of the county phase, the Oregon Health Authority is issuing updated guidance for zoos, museums, and outdoor gardens to allow them to open statewide. And I'm happy to say that our collegiate athletes will return to train by mid-June under specific health protocols to keep them safe and healthy and the staff healthy as well. I know this is a lot of information. You can read everything online at coronavirus.oregon.gov. The Oregon Health Authority will review all the relevant county data tomorrow, and I will announce on Thursday the initial counties that can move into phase 2, allowing those counties to move forward as soon as Friday. A final reminder, any reopening comes with risk. That's just a fact of life right now. We need to reduce the risk that comes with reopening. So, my fellow Oregonians, you have further opportunity to show that you are looking out for your friends, your family, and your neighbors. Wear a face covering. Keep your distance. Avoid large gatherings. Keep it local. And wash your hands, cover your cough, and please, please, please stay home when you're sick. Regarding face coverings, at the state level, they are strongly recommended. For employees in many businesses, they are required. And I want to state clearly that I fully support local jurisdictions, particularly cities and counties with larger densities and populations, who want to pass ordinances requiring the public to wear face coverings in other settings. Let me say one more thing. I held a press conference on Monday to add my voice to the clarion call we are hearing across the entire United States of America for racial justice and police accountability. I count myself as one of the many white politicians whose good intentions haven't done enough to tackle the scourge of systemic racism. I was pleased to see several very thoughtful proposals for reform issued by the legislature's People of Color Caucus this week. I look forward to working with legislators to get these proposals to my desk so I can sign them as soon as possible. It's also important to note that the unrest and protests happening across Oregon and the entire country come amidst a global pandemic that has sickened and killed Black, Latinx, Pacific and Islander, and other communities of color at disproportionate rates. And as we work to reopen the economy and build a safer and stronger Oregon, I am committed to putting our historically underserved communities at the forefront of our recovery plan. Now, I'd like to ask Oregon Health Authority Director Pat Allen to give us an update on the contact tracing teams that are being deployed around the state, as well as the latest update on the state's testing capacity. Director Allen.
Thank you, Governor Brown. In mid-May, I sat here with the governor as she announced the first counties that had met the criteria to begin reopening. Since the first 31 counties opened, 4 more opened in subsequent weeks. Multnomah County is getting its application ready now. At that time, I talked about the progress Oregonians had made together to contain the spread of COVID-19. Hospitalizations were declining, which meant fewer people were getting seriously ill. Testing was increasing, which meant we had a better chance to identify infected people quickly and keep a lid on the virus. The percentage of positive tests had dropped from 4% to 3%, which meant testing was becoming widely available and accessible, and our testing guidelines were accurately matching people who needed to be tested. But I also said reopening was not without risks. Oregonians needed to exercise caution and care to prevent the virus from bouncing back. As much as we all wanted to see normal life return, we couldn't open the door to COVID-19's resurgence. More than 2 weeks later, I think it's safe to say our situation is stable. Oregonians have been doing what they need to do to keep themselves, their loved ones, and their neighbors safe. It has in fact been a team sport. As stores, salons, and restaurants have reopened across the state, COVID-19 has not reemerged with renewed ferocity. 2 weeks ago, Oregon had the 5th lowest COVID-19 infection rate in the nation. Today, we have the 4th lowest. There are other encouraging signs. Newly reported cases have been on the decline until just recently. On May 15th, the Oregon Health Authority reported 63 new cases. Today we're reporting 65. Over the past 2 weeks, we have seen a decline in new cases until recently when we saw a small percentage increase in positive cases. However, testing also increased, and we believe some of that jump has been new cases has been a product of that increased rate of testing. Hospitalizations continue to fall. Yesterday, there were 102 Oregonians hospitalized with confirmed or suspected COVID-19 cases. 2 weeks ago, there were 161. These daily totals reflect a downward trend in the number of Oregonians who suffer severe cases of COVID-19. COVID-19 testing continues to increase while the percentage of positive tests has declined. Last week, 17,447 COVID-19 tests were conducted in Oregon, the highest weekly total since our first case was diagnosed at the end of February. And we have the ability to conduct more. Our statewide capacity remains at 37,000 tests. At the same time, our positive test percentage was 1.7%, which was down from the 2.6% positive rate on May 15th. Nationally, the rate of positive tests is approximately 12%. This difference means Oregon's low case rate is not a result of lack of testing. In fact, it's the opposite. While many parts of the nation continue to struggle to test residents who are sick, Oregon is testing more people and more people who are actually well. But like I said 2 weeks ago, COVID-19 is still present in Oregon. Every community remains vulnerable to the virus. That means our personal actions will either slow the virus or speed its spread. State and local public health officials remain vigilant, and we will deploy all the tools we have at our disposal to suppress COVID-19. Until we have a vaccine or an effective treatment, those tools continue to be testing and tracing. This week, the Oregon Health Authority is distributing more than $11 million to local public health departments and tribes to support the ongoing expansion of contact tracing in Oregon. The funding will enable counties and tribes to hire and maintain a larger staff of contact tracers. Contact tracers find people in the community who may have been exposed to COVID-19. They warn them about their exposure, tell them to isolate themselves so they don't infect others if they become sick, and connect them to support services, including alternative housing if necessary, so they can keep others out of harm's way and get through their illness. We are requiring counties to ensure that contact tracing is conducted in partnership with community-based organizations that have deep roots and strong, trusted relationships with their communities. As a part of this effort, the Oregon Health Authority will directly contract with community-based organizations so they have the resources they need to partner with public health in conducting effective contact tracing. To work, contact tracers must speak the language and call on the values of the communities they serve. Involving community partners will help contact tracers connect with more people, win their trust, and gain their cooperation, so we have a better chance of keeping the lid on COVID-19. We will continue to expand testing. We will continue to work with our federal partners to make more collection kits available in Oregon and reduce the supply chain bottlenecks that have constrained testing in the past. We'll continue to make testing available in more locations like pharmacies. We'll leverage our resources to ensure that vulnerable populations and communities are prioritized for testing. We are expanding our testing criteria today to asymptomatic individuals, those who don't have COVID-19 symptoms, who are in populations historically underserved by our health systems, and thus more at risk of COVID-19. And we'll continue to review and revisit our testing guidelines to ensure we are identifying people who are infected with COVID-19, including people who may be pre-symptomatic or asymptomatic, so they can take care of themselves and take care of others by limiting their contact with family, friends, and coworkers. Finally, I want to acknowledge that we cannot contain the coronavirus without doing something about the social inequities that fuel its spread. A crisis has a tendency to expose your weaknesses and areas where systems are inadequate, and this pandemic has been no exception. The protests of the killing of George Floyd, while not directly related to the coronavirus, have exposed the fundamental flaws in our justice system. In the same way, the COVID-19 pandemic has shown how far short we are from eliminating health inequity in our state. The impacts of the coronavirus pandemic have fallen especially hard on communities of color across the nation and in Oregon. A centuries-long history of racism and oppression have led to the very health conditions that exacerbate the impacts of COVID-19. At OHA, we've been too slow to recognize that threat and act on it. For that, I'm truly sorry. This is a time when people are angry, hurting, and afraid. I want to acknowledge those very real feelings. I want to acknowledge the failings, including OHA's and including my own, that have contributed to them. OHA will do better. I will do better. We have to. The health and safety of everyone in our communities depends on those of us in positions of privilege and leadership taking action to rectify inequity and make sure our healthcare system meets the needs of everyone it must serve. OHA has been involved in conversations with leaders of communities of color in Oregon to chart a better path. For the COVID-19 response, this includes improving collection of race and ethnicity data to better understand how hard the virus is affecting different communities, improving access to testing, treatment, and support services so we know who's infected and we can help them recover, and our most vulnerable communities receive priority for any emerging therapeutics or vaccinations. Supporting community-centered outreach and education for people to know how to protect themselves and their families and get the help they need. And helping more people get counseling to ease the worry and distress that can stem from the health and economic impacts of this disease. I am committed to taking these steps necessary to be responsive to and engage in co-creation of solutions with communities of color to improve health outcomes. At a time when so much seems to be driving us apart, it's both ironic and true that a deadly virus such as COVID-19 reminds us of our common humanity, especially our shared vulnerability, our mutual dependence, and our collective capacity to overcome grave threats by working together. As Oregon moves into the next phase of reopening, I'm counting on Oregonians to continue to work together to keep each other safe and suppress the spread of COVID-19. Now let me turn it over to Dr. Sidelinger to talk about the criteria we're using to evaluate whether it's safe for counties to enter phase 2 of reopening.
Thank you, Director Allen. I'm Dr. Dean Sidelinger, the State Health Officer and State Epidemiologist in Oregon. We know that the impacts of COVID-19 and the measures we've taken to control the outbreak have had tremendous impacts. We know that many people are scared, so I want to assure you that we are moving forward with safety in mind. As Director Allen said, I want to walk you through the criteria we're using to evaluate whether counties can move forward into phase 2 safely. As you recall, we had 4 main prerequisites for entering phase 1. Statewide, there has been a leading indicator, the evidence of declining transmission of COVID-19 as shown by a drop in percentage of people coming to our emergency rooms with symptoms of COVID-19. We looked for a 2-week period of declining hospital admissions, indicating that serious disease from COVID-19 was going down. We were looking at the county's contact tracing plan and if they had the capacity to quickly ramp up their contact tracing capability in response to this outbreak. And we were concerned about our healthcare capacity. Do we have the capacity to treat those most seriously ill with the personal protective equipment on hand to respond to a surge in cases if that became apparent in our state? To date, 35 counties met these initial criteria, which allowed the residents to return to some degree of normal activity, such as getting a haircut, going to a restaurant, working out in a gym, shopping at a mall, or socializing in small groups, all with physical distancing in mind and with covering their faces when possible and when physical distancing wasn't able to be maintained. As we consider the county's readiness to enter phase 2, we're looking at some additional criteria which reflect the importance of managing the risks of COVID-19 infections and preventing new outbreaks from occurring in our state. We want to assure that our public health system, our local and tribal partners, with assistance from the state, can follow up timely with cases that are reported to us. 95% of that contact we want to happen within 1 day, and our counties have risen and are meeting that. We want to be able to trace those individuals who may have been exposed to someone who's sick. And we want to know that 70% of those people, we can tell where they got sick. That would indicate minimal community spread in Oregon. We are close to meeting that criteria statewide. We want to see no increase in cases or the positivity in our tests. That means we're looking at a percentage. We want to see our cases come down or stay flat in cases over the last week. And we don't want to see an increase in the percent of positive tests that we're seeing throughout Oregon. And as Director Allen told you, we are doing very well with that metric right now, indicating that we are testing adequately across the state, even though we know we have more work to do in many of our communities. Today, our OHA epidemiologist will be pulling the data and analyzing it, and we will use this most up-to-date data and use the numbers to evaluate counties' readiness to enter phase 2 and make recommendation to Governor Brown's office about which ones can move safely forward. We have also asked counties that if they're not meeting these metrics, that they provide their mitigation plans or what they need to do differently to meet these metrics. But that's not the end of the process. We may recommend that a county be approved to move forward when they show they have robust mitigation plans, but we will continue to watch the data and continue to partner with counties to see what they need to keep their residents safe. As Director Allen stated, counties are expanding their contact tracing capacity. If they're falling short on their ability to contact 95% of the new cases within 24 hours, but they can show how they'll address that by deploying more contact tracers or implementing other measures, we may greenlight them to enter phase 2. We look at all of these measures together and want to look at the whole picture to make sure we can safely move forward. As always, we'll continue this monitoring on the county status and progress on measures to see if it's safe for them to remain where they are in reopening and move forward. I want to continue to emphasize that reopening is not an on-off switch. If a county slips on one or more measures, that's a caution light that tells us to pay more attention, shift strategies, mobilize more support. But if we begin to see a looming danger, such as widespread cases that have no epidemiological links to another case and no link to an outbreak, if we see increased positive tests and other warning signs, then we may need to consider dialing back our permitted activities in that county or in that part of the state. I also want to echo what Director Allen said. We're all in this together. State, local, and tribal public health will use every tool we have to keep people safe as counties reopen. But we're counting on the public to do its part. Practice physical distancing, stay 6 feet apart. Don't gather in large groups. Wear cloth face coverings when you're out in public or other face coverings to protect others in case you have COVID-19 but you don't yet show symptoms. Being outside is safer than being inside, so if you can move your activities outside, do so. We're very good at doing that in Oregon in the summer. Find ways to stay socially connected to the older adults in your life or the friends and families with chronic health conditions while remaining physically distant. And if you get a call from a contact tracer, answer the call. Our ability to suppress COVID-19 and save lives depends on all of us working together to keep each other safe. We did it by staying home to save lives. We hope you'll do it again by taking responsibility for your own health and that of your families and communities. Thank you.
Hi, everyone. Charles Boyle, the Governor's Office. I think because of the technical difficulties we had earlier, we have quite a few people on the phone line, but not very many people in the question queue. So please go ahead and start pressing 0 to work with the operator and get on for a question. First up, I believe we have Kevin Winter from the Lake County Examiner. Go ahead, Kevin.
This is Kevin Winter from the Lake County Examiner with a question. I haven't seen any guidance of how long phase 2 will last. Has that been decided yet?
Great question, Kevin. I'm going to turn that over to Dr. Sidelinger.
I think phase 2 is where we're going to live for the next several months. This will likely carry us through the summer, perhaps into the fall, as we look for those effective treatments that can keep people from getting sick once they have the disease, and ideally a vaccine that can prevent it, but we know that's a ways off. We'll continue to monitor the spread of the disease, see if we can open up additional activities or if we need to pause for a time. We know that we need to move forward cautiously in the fall as students return to school for K-12 schools and our colleges and universities. So these activities, the ability to stay 6 feet apart from people, covering our faces, and changing our normal day-to-day lives are with us for a while, with phase 3 off in the distance, but something we can get to if we all work together.
Thank you.
Thanks, Kevin. Again, please just press 0 to ask a question. If you're having trouble with that, you can also email your questions to Nikki Fisher, but we just tested and I believe pressing 0 is working, so please keep working with the operator on that. Next up, we have Brad Schmidt from the Oregonian. Go ahead, Brad.
Hi, Governor. I just actually wanted to follow up on what Dr. Sidelinger said. Are you anticipating that schools will reopen this fall in a traditional setting of students attending class in classrooms?
Brad, it is one of my top priorities to make sure that we can get students across the state back into the classroom in the fall. We have to do it in such a way that protects their health and safety, and obviously the health and safety of teachers and staff in our districts around the state. I suspect it will not look like the traditional classroom setting, and the Department of Education is collaborating with teachers, with parents, and with public health experts to figure out how we do this in a way that ensures safety, but also enables our children to learn. And I think parents around the state are ready to get our children back into school and to gobble up those educational opportunities as soon as possible.
Just a quick follow-up, if I could. When do you expect to make an official decision on how school reopening would look?
Great question. We'll be working on that. The department has been working on that, frankly, since we began shuttering down the state, and we'll be releasing those details over the coming weeks.
Great. Thanks, Brad. Looks like we have some people working together to the question queue. Again, please press 0 to work with the operator. This next question comes from
What was the first question, Charles? Could you please repeat the first part of the question?
The first question was, why not enforce the executive order on large gatherings, and do you expect others to follow the order?
Specifically with regards to the protests? Yes, all right. So, look, I think it's critically important that Oregonians and Americans exercise their right to free speech. I am outraged, like my fellow Oregonians, about the lack of progress we have been able to make to tackle the issues of racial injustice in this state and in this country. And I think it's critically important that Oregonians express that frustration, that anger, and that outrage. It took my breath away to see the photo this morning of Oregonians on the Burnside Bridge. That is how we change hearts and minds and change systems and change cultures. I also just want to encourage folks to continue to be safe, to wear face coverings, to continue to socially distance, to use hand sanitizer, and obviously cover your face when coughing. I have, to the question, specific question about tear gas, I have not had a conversation with the City of Portland or Multnomah County about the use of tear gas last night.
Looks like we have a few people joining the queue now. Please press 0 again. Looks like it is working now. Next up, we have Sean Hall from the Grants Pass Daily Courier. Go ahead, Sean.
Thanks very much. I hope you can hear me. I had a question regarding rallies because we had about 250 people in front of our courthouse yesterday, but I believe that has been answered and addressed. Bonus question, if I may then. Governor, any regrets about not opening church services earlier, allowing those larger gatherings in churches?
I think it's critically important for Oregonians of all faiths to continue to practice their faith. I know for many it is a source of comfort. It creates a sense of community, and it lifts people's spirits. I have encouraged Oregonians to practice their faith, whether they attend a synagogue, a mosque, or a church, carefully and in limited numbers. In phase 2, we are increasing the size of gatherings up to 250 based on, in addition, square footage space. And I think that will allow more Oregonians in the appropriate counties to participate in a sharing of their faith with their fellow Oregonians.
Thank you.
Great, thanks, Sean. Just a reminder, if you're having trouble with our phone system, you can also email Nikki Fisher with a question, but please press 0 to work with the operator. Next up, we have Nick Budnick from the Portland Tribune. Go ahead, Nick.
Hi there. Thank you very much, Governor and everyone. I'm hoping to follow up on the school reopening questions. My questions are, what are the options being considered? Can Dr. Sidelinger give some idea of those? Will it be 1 week on, 1 week off? Are there trailers or some other alternative classrooms being set up, more teachers hired? What is it going to be? I think there's a lot of out there that are wondering that. Thank you.
Yeah, so thank you for that, Nick. We've been working very closely with the Oregon Department of Education to outline what schools in the fall could look like. We can't predict the future, and we need to continue to monitor the spread of COVID-19 in Oregon and in other states. But as we're making plans that are similar to the guidance you've seen for the rest of the state. Can we bring students back to school and keep physical distance between students and teachers and other staff? Use face coverings where appropriate, increase our sanitation by washing those commonly touched surfaces more often, access to sanitizer and places to wash their hands so that we can limit the spread. We know that depending on the spread of disease in our state or in particular communities, there may need to be some hybrid learning with some students on campus to limit the size of the gatherings on campus, with others doing distance learning and possibly some trade-off. We want to lay out some public health principles that will keep the staff, the children, and the family safe, and allow schools to operationalize that in the best way that they can. For some schools, that may be a staggered schedule. That may be bringing in additional space or using other space, but we don't want to tell schools what to do or how to do it. We want to tell them what to do, which is to keep the school community safe, and we will continue to have those conversations and continue to reevaluate and readjust that guidance probably up until the time we think school may start. And that's a new normal for us, for the Department of Education, for the Oregon Health Authority, for our school boards, for our school principals and our teachers, that we need to be flexible and work to do everything we can to get students safely back to school and learning, because the best thing for a student is to be in a chair in front of a teacher learning.
Director Allen also has a comment, given that he spends a bit of his free time on a school board.
Yeah.
Director Allen.
Thank you, Governor. Yeah, everyone's got to have a hobby, and mine is serving on my local school board. And as an individual board member, I just want to endorse what Dr. Sidelinger just said. Every school district and every school is different, and getting the general rules of the road and the guidance of how to approach bringing kids back to school is really valuable to then allow us as a district to figure out how to engineer and design and implement that in our local settings, in our local buildings, and in our communities. That broad set of guidelines and then giving us that freedom to design is going to be critical for us to be able, all across Oregon and school districts everywhere, to be able to do this effectively.
I'll just add one other thing. We are working with legislative leadership to make some more significant investments in broadband. My hope was that the internet would literally be a bridge between our urban and rural communities, and unfortunately, we don't have the infrastructure for all of our homes, all of our schools, and all of our businesses around the state to have access to the internet. I know that it has put a lot of our kids across the state at a disadvantage because of lack of access to the internet. So we are going to redouble our efforts, make some emergency investments, and work with our partners across the state to make sure that we build a system that will enable everyone, regardless of where they live in the state of Oregon, to have access to this critical educational tool, economic tool, and now we're learning under COVID-19, of course, cultural tool, and of course, critically important health tool.
Thanks, Nick. Just a quick reminder to folks, please press 0 to enter the question queue. Looks like a few more people are being added now. Next up, we'll go to Galen Etlin from KGW. Go ahead, Galen.
Thank you very much. Yes, this is Galen Etlin at KGW. Now, we've seen the large gatherings and demonstrations around the state that we were talking about earlier. How has that played into the reopening conversation, and how do you plan to reach some of those frontline demonstrators with COVID-19 testing, especially when, like you mentioned, we're talking about communities of color that are typically underserved?
So I just have to say, like public health officials across the country, I am concerned about large gatherings. We know that these are what are considered super spreaders, and that's why I encourage Oregonians that are participating to make sure that they're following safety guidelines, including wearing face coverings, using hand sanitizer, and covering their coughs and sneezes. In terms of how it plays out, we are absolutely committed at the state and at the Oregon Health Authority to make sure that there is the testing capacity available in our communities of color, particularly the African American community, the Latinx, Pacific Islander communities, and the Native American communities.
May I add to that, please?
Sure.
We are working at the Health Authority right now with local public health, including Multnomah County, and others to expand testing right now in communities that are most at risk of COVID-19. And as I mentioned earlier, we're expanding our testing criteria for at-risk communities to include asymptomatic testing. And so we think those things will come together to also support being able to respond to anything that emerges as a result of these events.
Great. Thanks, Galen. Next up, we have Gary Warner from EO Media. Go ahead, Gary.
Yeah, hi. I wanted to find out what your plans are for community colleges and universities. And along that line, what are you going to do about major sports like college football and the University of Oregon and Oregon State?
Gary, let me tackle the sports question first. I was extremely disappointed to not be able to see Sabrina, Satu, and Ruthie cut down the nets at the NCAA finals in New Orleans. I know that our college athletes have invested so much in their lives to be able to compete at that level, and my heart breaks for them. We are working with public health experts, with training experts to make sure that collegiate sports can begin training mid-June. I'm confident that regardless of the time frame and the comparison to the state of Washington, that our Ducks and Beavers can tackle the Huskies and the Cougars anytime. So that is obviously on a limited capacity for training. In terms of colleges and universities, our education system is truly the elevator that lifts everyone. And I think it's critically important that we get our students at the community college level and at the university level back in the classrooms as quickly as possible. At the higher education level, they've been able to utilize online learning systems effectively. But I do think it's really important for people to be in a classroom. I had the opportunity this week to participate in a Zoom room classroom. It was a small class, and it was the School of Public Health, PSU, OHSU. And it was an incredible learning opportunity for me, and I was blown away by the questions the students were asking. I think it's so important that we work to get our education system back to normal, because it's a game changer for our kids, for our students, and for our seniors in learning mode.
Thanks, Gary.
What type of time schedule do you have on that, though? You've mentioned with public schools that perhaps there might be something as early as next week in terms of guidance. What about with the universities and colleges? When are they going to know what's going on? High school graduations are going on this week. A lot of those students are going to want to know if they can come to Corvallis or Eugene or any of the other universities and colleges.
Director Cannon is working with the universities. They are developing, and the community colleges, they are developing their own guidelines. We're working with them. I know that they are keeping their students apprised, and we'll work to get that information out publicly as quickly as possible.
Thanks, Gary. Next up, we have Alyssa Rubin from KDRB. Go ahead, Alyssa.
Yes, Governor, I was wanting to ask, is 250 people the new limit for all gatherings? You mentioned faith-based gatherings. We'll see that increase. Is that applicable to all gatherings?
Thanks. I'm going to have Dr. Sidelinger respond to that question.
Thank you, Governor. You know, we're still finalizing some of the details, but the way it'll break down that the normal guidance will be people can gather in groups of 50 people indoors or 100 people outdoors, unless specifically called out to not meet those guidance. Those kind of settings will be things like restaurants, gymnasiums, faith-based gatherings, other gatherings, where we will make recommendations, requirements that physical distancing is maintained, and they can use the square footage they have available to them to make sure that people have at least 35 square feet of space, and they can put up to 250 individuals in that space. whichever is lower. We want to ensure that people come back together for various reasons, to attend faith-based services, to gather for other reasons, for entertainment, and can do so safely. So there are specific venues where that will be called out, where they can go to this higher level. But we will also increase the size of people who can gather in your backyard from a barbecue for those people entering in phase 2. So we'll have some very specific guidance and which guidance pertains to which sector so that we can try and maximize the opportunity for people to get together and do so safely as we continue to monitor the spread of COVID-19 in the state.
And I just want, Oregonians have done a really incredible job making really tough sacrifices. We have really changed how we live. I just want to encourage Oregonians to continue to be kind, to continue to be smart, to continue to protect their family members, their neighbors, and their fellow Oregonians.
And really quickly, could you say what that square footage was again, Doctor?
So in order for people to maintain 6 feet of distance, if we look at a space and say, most people know the square footage of their establishment. So if you say 35 square feet per person, that will allow people to stay 6 feet apart. Use the face coverings when they can't mention that, but that 35 square feet is kind of a measure that we're using across many sectors to ensure people stay safe.
Thanks, Lisa.
Thanks.
Just a reminder to folks, if you're having trouble pressing 0, you can also email your questions to Nikki Fisher, but please try and press 0. Next up, we've got Sean Hall again from the Daily Courier. Go ahead, Sean.
Hi, Governor, I wanted to ask about nursing home visitation. I don't know what the new guidance will be. That's an important population, and visits from family and friends are important. And pardon me, but besides nursing home visits, maybe I could also ask you, if I may, get 2 more regarding masks for restaurant workers. Apparently that's difficult for people in restaurant kitchens. And then also jet boating. How do you, rules regarding jet boating, how do you social distance on jet boats? So nursing homes, restaurant kitchens, and jet boating. Forgive me for trying to fit that all in.
Okay, Sean, that's quite a variety of questions. I'll try and respond briefly to all of them. Face coverings for our vulnerable employees on the front lines, including restaurant workers. In certain sectors, they are required. We are working with our Business Oregon, our Economic Development Agency, to make sure that there are resources on the ground, particularly for our small businesses that want to make sure that their employees can be protected and be safe by assisting with the costs of face coverings. Obviously, in certain circumstances and certain businesses, that's extremely difficult. In terms of nursing homes, I know this has been really, really hard for people. I know it's really hard for families. I mentioned earlier my 90-year-old uncle celebrated his birthday, his 90th birthday, and normally there would be cake and ice cream, and we would all gather. That didn't happen this time. I applaud the creativity of folks across the state as they are visiting their seniors, their elders, their grandparents, their aunts and uncles in assisted living facilities. I've seen hand touching with glass in between. I've seen balloons. I've seen drive-by parades for folks celebrating special birthdays, and I just appreciate the creativity and the innovation when we can't be together safely. Our folks in our assisted living facilities, our nursing homes, are some of our most vulnerable Oregonians. And we have a team of experts at the Department of Human Services and the Oregon Health Authority putting their combined expertise together to make sure that we are providing the appropriate level of safety and sanitation measures in these 650 facilities around the state of Oregon. Dr. Sidelinger, Director Allen, would you like to add anything? to either, any of that.
Yeah. So I will say, I echo all that about our long-term care facilities, and it's a very, difficult situation, I know, not to be able to visit loved ones. I do also want to pick up on that jet boating question for those jet boating aficionados out there. It is hard to maintain physical distance in a small space. So we encourage, sanitizing spaces before people get on, the use of face coverings. The good news is that when you're on a jet boat, you're outside. The likelihood of transmission from one person to another is less, particularly as you're going about enjoying the day. So certainly we encourage people to continue to take precautions to protect themselves and those around them, but they can enter these activities safely, even when physical distancing isn't available on a space like a jet boat. So that's why those recommendations are out there.
And if I could add one other thing, Dr. Sidelinger early on talked about, in answering the question about phase 3, that as phase 2 continues, we'll likely make adjustments to guidance as we learn more. And we've been saying from really the outset that we learn more about the coronavirus and about COVID-19 every single day. And I think that's going to apply to guidance as well, as we learn more about what kinds of activities have what sorts of risk. One of our general principles is outside is better than inside. And I think guidance around outdoor activities is an area where you may see things evolve as we go through the summer and learn more about what are the risks of certain kinds of activities.
I just commit to Oregonians that we will continue to make decisions based on science and data informed by our medical advisory panel and epidemiologists and public health experts. And it's critically important. We are all in this together. Your actions really do matter. So I want to encourage you to be smart, be kind, and continue to protect your families, your friends, and your neighbors.
Thanks, everyone. That's all the time we have for questions today. Apologies again for the technical difficulties. If you have trouble